It's called the Center for Clinical Optimization. What it does is it's addressing a critical and important gap in care for patients who need surgery but are not quite yet ready for surgery. Patients are told that they need a back surgery or they need a knee replacement or a hip replacement, but maybe they're not ready because they're overweight or they haven't stopped smoking or they have uncontrolled diabetes. Historically, there just hasn't been a clear pathway to get them there, and as a result, the patients tend to fall through the cracks. So what this program does is it provides that structure in a way that patients can reach surgery safely and position themselves for the best possible outcomes.
We're really excited to launch this center. We believe it will help patients live fuller, more active lives. Spine patients just do better if they're healthier. That's the bottom line. Whether they are going to have a surgery, whether they're trying to avoid surgery, whether they never want to have surgery but just want to address their spine problems, if they can become more active, lose weight, optimize their overall bone health and muscle health, and quit smoking, then they will do better and they will feel better. And that's what our goal is.
There's a comparison I like to use with my patients. Compare surgery to a marathon. I tell them you don't wake up one day and sign up for a marathon and go around the next day. You prepare for it. From a hip and knee perspective, we restore mobility, we restore quality of life. But if we don't have patients as ready as possible for their surgeries, then we're missing a potential for intervention that will further improve the quality of life that we're trying to affect.
Patients need a clear, guided path to get there, and so that's kind of where I come in. The main things that I focus on are their modifiable risk factors. I see people who need help quitting smoking, patients who are too weak for surgery, and I help rehab them by nutrition, people who are overweight and need to get down to a specific BMI. GLPs are a great option to help people lose weight prior to surgery, especially in a shorter period of time. With GLPs though, people don't only lose their fat, they also lose their muscles. So I really hone in on preserving muscle mass through nutrition. It's not like a one-size-fits-all approach. I take into consideration everything about the patient. Everyone has different preferences, different time constraints, different lifestyles. So every single plan is calculated and tailored and unique to the individual.
You can have the best plan ever. If it doesn't fit the patient and it doesn't align with what they're willing to do, then they're less likely to do it. It requires someone sitting with them, understanding them, talking to them, and figuring out what they are willing or not willing to participate with and design a plan according to that.
A lot of my care plans are interactive, so I'll make them go home and fill out a checklist to make sure they're staying on track. Did they do their wall push-ups for that day? Did they do their sit to stand? Did they get into a pool and do some aqua therapy that week?
Here at University of Orthopedics, we're all about health. We just want patients to get better. We want them to be more active. We want to improve their pain. By making them healthier, they'll be happier, they'll live better lives, and they actually decrease the risk of surgery.
My goal is to make sure patients feel supported, involved in their care, and are confident going into their surgery. Having that person there for them is going to be a huge impact on these outcomes.